Welcome to another iPMI Global report. My name is Christopher Knight and I'm the CEO at iPMI Global. In this Regional Insights video report, we're going to explore the key differences between public and private healthcare in Latin America. We read the recent iPMI Global Roundtable report, which looks at iPMI, assistance, cost containment and pharmacy solutions in the region. We delve into the key differences between public and private healthcare in Latin America. Now, looking at funding and financing. Public healthcare in Latin America is often funded through government budgets, taxes, contributions from employers and employees. Now, these systems aim to provide healthcare services to all citizens, including those who cannot afford the private insurance. Public healthcare is generally subsidized or provided at low cost to patients. Private healthcare, on the other hand, is funded through private insurance premiums, out-of-pocket payments, and employer-provided health plans. Individuals and families opt for private healthcare to access better quality care, shorter waiting times, and a more personalized service. So no really different than anywhere else. And private healthcare services can be expensive, especially for specialist treatments. Again, no surprise. We move over now to look at service delivery and access. Public healthcare services in Latin America vary widely in quality and availability. It often suffers from underfunding, overcrowding, long wait times, which leads to an increased reliance on private insurance. Access to specialist medical care and reach in rural areas can be rather limited. Now, private healthcare facilities generally offer better access to specialized medical care, modern equipment, and shorter waiting times for consultations and for procedures. It provides faster access to healthcare. Now, quality of care can sometimes be a bone of contention. In the public healthcare systems, it can vary significantly. Public healthcare often suffers from inefficiencies. Private healthcare, on the other hand, provides in Latin America a higher standard of care with modern facilities, advanced technology, and specialized medical expertise. Patients typically experience more personalized attention in private hospitals and clinics. Now we can look at cost and affordability, which is obviously important to many. Public healthcare services are generally provided at a lower cost to patients, aiming to ensure accessibility for low-income populations. However, out-of-pocket expenses for medications, diagnostic tests, and certain procedures may still be required. Private healthcare, on the other hand, in Latin America can be expensive, especially for specialized treatments, elective procedures, and consultations with the top specialists. Costs are typically covered by private health insurance plans or paid out of pocket by individuals who can afford them. Coverage and scope. Well, public healthcare systems in Latin America aim to provide universal coverage, which ensures basic healthcare services for all citizens. Private healthcare coverage in Latin America vary. Private healthcare coverage in Latin America varies based on the insurance plans and the individual preferences. Now, what is the role of government in public and private healthcare in Latin America? They play a central role in overseeing and regulating public healthcare systems, setting healthcare policy, and obviously allocating the money, the funding, what's going to pay for it. Private healthcare operates under regulatory frameworks set by the government, but the sector is largely driven by market forces, competition among the providers, and consumer demand. Now, in summary, public healthcare in Latin America aims for universal coverage, but it does struggle with funding, with quality, and long waiting times. Private healthcare offers higher quality and faster access, but it is available to those who can afford it through insurance or direct payment. Private insurance does help bridge the gap by providing access to premium care for the middle and upper classes. Now, notably, public healthcare systems and products generally do not offer the mobility to seek help outside the country of residence, which is obviously a massive feature of iPMI. Now, thank you for joining us in this quick iPMI video report. I hope everybody is well, happy, healthy, and busy. We shall see you shortly. Thank you.